coming to you live from Indianapolis, Indiana, and we're here to serve you by providing up-to-date information and opinion on all matters pertaining to sickle cell disease. My name is Gary A. Gibson, and I am your host for the next 2 hours. Let me start by saying that I don't have sickle cell disease, nor do I carry the sickle cell trait. In spite of that, I am no stranger to sickle cell. Quite the contrary. You see, even though I don't have sickle cell, it has had a very huge impact on my life. That's because its complications took my wife from me after 12 years of marriage. It also caused her to have a miscarriage that resulted in the loss of our twin babies that she was carrying while in a sickle cell crisis. So all told, sickle cell has taken 3 lives from me, and I feel the pain of those losses every single day. I currently serve as the president and CEO of Martin Center Sickle Cell Initiative, a community-based organization that has been serving people with sickle cell for over 45 years. Each day I attempt to transform the pain of my losses into positive energy that is focused on making a difference for those who are battling sickle cell. From being involved with sickle cell for over 40 years, I am able to say that much progress has been made, but there is still so much work to do. This show is an opportunity to contribute to the ever-expanding dialogue about sickle cell that is taking place all around the world. Our show is about raising awareness, but it is also about so much more. I like to say that sickle cell awareness is important, but we need more than awareness. Those living with sickle cell are already aware. That makes me ask, so what are we doing for them? My answer is, not enough. That's why we've named this show the Sickle Cell Action Network, because awareness without action has very little impact. We want this show to be a source of information and a call to action to help those who must live with sickle cell in their midst. We have designed this show to provide information that is beneficial to patients, caregivers, family members, and friends alike. Most importantly, we want people with sickle cell to know and understand that they are not alone. The Sickle Cell Action Network show features live guests who are healthcare providers, patients, advocates, and others who are engaged in the fight to eradicate sickle cell and ease its burden on those it affects. Today we are honored to have a very special guest to talk to us about medical complications with sickle cell. Joining me in studio today is Dr. Rakesh P. Mehta, a board-certified hematologist who also happens to have earned a Patient's Choice Award for 2015. We're honored and thrilled to have him with us here today. Before we get to today's topic, however, I want to share some of our upcoming topics with you so that you'll know what we're going to be up to. In future weeks, we will cover such topics as exercising with sickle cell, the global state of sickle cell research update, traveling with sickle cell on social media, connecting the sickle cell community. So, as you can see, we are very serious about sharing valuable information, and we hope that you will join us every week, same time, same station. If you've missed some of our previous editions or wish that you could listen to them again, don't worry. Just go to the Martin Center Sickle Cell Initiative YouTube page and you'll find them there. Now let's get on with our show, and we'll start with this week's edition of Sickle Cell News Update. We have a few stories to cover for you. Mostly they're short stories, and they're just stories of general interest. And this one comes to us from Nigeria. And it says 20,000 receive sickle cell treatment in Katsina. So the story says no fewer than 19,283 sickle cell patients are currently receiving free drugs in sickle cell clinics across Katsina State, Governor Aminu Bello Masari has said. Speaking during the official commencement of screening and treatment of 2,000 patients, Masari said the state government was committed to addressing health challenges confronting the state. Masari, who was represented by the state deputy governor, reaffirmed his administration's commitment to provide sound health care services to the people. In an address, the wife of the president, Aisha Buhari, initiated the health screening support, urged victims of sickle cell and their parents to seek medical attention. Ms. Buhari, who stressed the need for routine screening so as to ascertain genotypes, especially before marriage, enjoined the school children gathered for the screening services not to go into relationships without screening. She said the screening exercise was born out of the desire to create awareness and awaken consciousness of the people on the dangers of sickle cell. And that's a good story coming from Nigeria, which, as some of you may know, has the largest birth rate population of people with sickle cell in the entire world. And we have had several stories recently about Nigeria, and we see that Mrs. Buhari and her daughter, we have talked about in the past, as her daughter has become an ambassador for sickle cell in the state of Nigeria. It's great to see Nigeria doing more and more with regard to sickle cell. Our next story comes from the Red Cross, and they are putting out an emergency plea for blood. And this is important because many people who have sickle cell disease receive blood transfusions. That means that they rely on people to donate blood. According to this story, the American Red Cross has an emergency need for blood and platelet donors. Severe weather since the start of January has forced more than 300 blood drives across the 20 states to be canceled. This means more than 9,500 donations weren't collected, further depleting an already low winter supply. Basically, it says generous donors allow the Red Cross to provide blood products to patients like 2-year-old Charlie Stevens, who has received both blood and platelets during treatment for acute lymphoblastic leukemia. Her mother, Michelle Stevens, donates blood regularly. The Red Cross must collect about 14,000 blood and platelet donations every day for the patients at around 2,600 hospitals and transfusion centers nationwide. Blood and platelets are needed to respond to patient emergencies, including accident and burn victims, heart surgery and organ transplant patients, and those receiving treatment for leukemia, cancer, or sickle cell disease. If you're listening to this and you have a donation center nearby, consider the fact that you could help someone by going to make a donation, because someone with sickle cell very well might end up with that blood, and it will be very helpful to them. Another story that we have comes from Hales Owen in the UK, and it's a little heartwarming story about a gentleman who is decided to try to raise money for sickle cell in his area. And in order to do that, he's going to step into the boxing ring for the first time. And he's doing that to fight for charity. Reuben Martin, age 37, is learning the sweet science of boxing so he can raise cash and awareness for the Sickle Cell Society in England. Mr. Martin will be given 7 weeks training and will box at the TST Promotions event at the Second City Suite, Sherlock Street, Bingham, on Saturday, March 12th. He said, "I wanted to take the chance to raise awareness about sickle cell disease by putting my gloves on and training for the first time. I will be training for 7 weeks and going in the ring for three 2-minute rounds. The money raised will be given to help sufferers of the disease. Many of us in the Afro-Caribbean community have been affected by sickle cell," he said. So here's an interesting story. We talk about these fundraisers every now and then, but this is the first time I think we've talked about one where somebody's going to get in the boxing ring, Mr. HB, my producer. And that's going a little far for me. I would do something else, but I'm very happy that Mr. Martin is going to raise money for sickle cell. My last story comes today from, this one is from called the Dubai Africa Sickle Cell Project. They all have named an ambassador named Mercy Aigbe Gentry. And Mercy Aigbe Gentry, who was recently named Fashion Entrepreneur of the Year in 2015, is in double celebration as she was also unveiled as the first ambassador of the Dubai Africa Sickle Cell Project. Organizers say Dubai Africa platform is to reach out to people affected by the disorder, create awareness, and educate the public on how to break the sickle cell circle, how to manage the crisis associated with sickle cell disease, and the importance of knowing your genotype before saying, "I do." Shedding light on the project, they recalled that in April 3rd in 2015, a young lady named Moyo Adesanmi lost the battle to sickle cell after fighting the disorder for 28 years. There are lots of sickle cell warriors out there constantly fighting the sickle cell disorder. Nigeria has the highest number of people surviving from the sickle cell anemia disorder. So it's great to have another ambassador out there raising awareness in parts of the world where sickle cell is rampant, and we thank Mercy for her assistance. That's it for our sickle cell news update for today. We're going to take a break, and when we come back, we're going to be speaking with Dr. Rakesh Mehta, and he's going to take us step by step through how medical complications are involved with sickle cell. We'll be right back.
Have you heard about the EPIC study? It's an international research study evaluating an investigational drug aimed at shortening the duration of painful crisis. And with over 50 sites in the U.S., there may be a site near you. To learn more and to find out if the EPIC study is right for you, visit www.theepicstudy.com.
Welcome back to the Sickle Cell Action Network Internet Radio Show. My name is Gary A. Gibson, and I am your host, and I'm very delighted to have Dr. Rakesh Mehta with me today. We've been having a great conversation while the music was playing during our break, and I really want you all to get to know this gentleman. I really feel strongly about him and that he's here to help, and we're going to give him an opportunity to share with you some of what he's been sharing with me. But the first thing I'd like to do, as always, is I ask Dr. Mehta to tell us a little bit about himself. And, questions like where are you from originally, where did you obtain your training, how long have you been treating people with sickle cell. But first, let me just say welcome, Dr. Mehta, for being on our show today.
Thank you. I'm honored that you would ask me to participate. That's great.
Thank you. So go ahead. Tell us a little bit about yourself. Where are you from originally?
So I actually grew up on the East Coast.
Okay.
I grew up in a steel town, Bethlehem, Pennsylvania.
Yes.
Which was a steel town when I was young and is no longer a steel town as the economy and life has changed there. But I grew up in Pennsylvania. I went to college in Washington, D.C. at George Washington University, and then elected to go to medical school at Penn State, which is in Hershey, Pennsylvania. It's actually not on their main campus.
Right.
After medical school, I went to the University of Wisconsin in Madison, and I did my training there, which consisted of 3 years of internal medicine and then specializing in hematology after that. Most of my colleagues, when they train, they do both hematology and oncology. Where I trained, I actually only did hematology.
Okay.
So I'm not even an oncologist. I'm strictly a hematologist.
Okay.
I finished my training in 2000. My wife and I moved down to Texas for a couple years. Recognized that the Midwest was a much nicer place to live than Texas, and moved back here back in 2002, and I've been here ever since then and treating sickle cell patients ever since then as well.
Okay.
And through my training as well, obviously.
Well, why did you pick hematology?
That's a great question. Early on, when I started my residency in internal medicine, I wasn't sure what I wanted to do, and I liked hematology because I was interested in the diseases, and it seemed was a specialty in which you could actually talk and connect with patients, and I think that was one of the major things that drew me to hematology.
Okay. So, as one who has been treating people with sickle cell disease for many years, how would you characterize this disorder?
So, I actually brought a quote, because I think this is said much better by a gentleman who's a pediatric hematologist who I believe is at Duke University. And in an article he once wrote, his quote that just struck me was that sickle cell anemia is more properly recognized as a chronic and progressively debilitating medical condition featuring ongoing hemolytic anemia and recurrent acute vaso-occlusive events with considerable morbidity from insidious but inexorable organ damage. And essentially what that means is there's two things that are happening with sickle cell disease, but it's chronically from really the onset of the condition causing damage to folks. And it's not just the pain that we typically think about with sickle cell disease, because that's obviously the in many cases the worst symptom that they have, but it is chronically affecting them. And it's something that as time goes on, their bodies are being damaged more and more by the sickle cell.
And that's why this is a good topic for us to cover, don't you think?
It's an excellent topic.
Yeah. One of the things that many people know little about is that sickle cell can and does impact every part of the body. We're going to discuss this in more detail as we go along, but I wonder if you would take a few moments to explain why sickle cell can cause so much damage to so many parts of the body. Why is that?
So there's probably two main reasons. One of those reasons has been well known for many years. I think the second reason we're starting to understand better, really probably in the last 10 to 15 years. The major component of it is that in our body we obviously have red blood cells, which if you kind of imagine them as like little dump trucks, they pick up oxygen in the lungs, they go to the body, they dump off that load of oxygen, and then they go back to the lungs. But those red blood cells have to be very flexible, You can almost imagine them to be kind of like one of those styrofoam discs that is able to sort of bend and move as it sort of navigates and works its way through all our different blood vessels. In sickle cell, there's a change in the gene of one of the proteins in red blood cells, hemoglobin. And that hemoglobin, which is supposed to carry the oxygen, if the red blood cell has less oxygen than normal, it causes a distinct sort of shape change to that red blood cell. It looks like a sickle under a microscope, hence the name sickle cell. But those sickle red blood cells lose their flexibility and essentially block off blood flow. So in the tiniest of blood vessels that we have, which we call capillaries, the red blood cells essentially get stopped or blocked off, and so no blood flow can pass that blockage. When tissue is no longer getting those red blood cells, they're not getting the oxygen that it needs. It's not getting any other nutrients that it needs, and it essentially is causing that tissue to die. And if you can imagine, if you take a rubber band and tie it really tightly against the tip of your finger, after a period of time, the tip of your finger is going to hurt, and that's because it's not getting blood flow. And that's essentially what's happening with sickle cell when it's blocking off the blood flow and actually causing that damage to the tissue, and one of the major responses from that is going to be pain. Mm-hmm. So that's one of the issues with sickle cell is how it sort of blocks off the blood flow and creates sort of tissue damage because you're not getting the nutrients that it needs. The second area that we're learning more about is that because these are not normal red blood cells, the body actually breaks them down sooner than normal. And the term we use for that is it's a hemolytic anemia, and that just means that the red cells are broken down sooner than they're supposed to.
So the average life expectancy for normal red blood cells is 120 days, and
That's
the
correct.
average life expectancy for sickled cells maybe 20 to 30?
Probably 20 to 30 is a good
Right.
estimation.
So that's what you're talking about.
Yep.
Okay.
And so as the body breaks down the red blood cells, it releases chemicals, and in particular, it consumes certain chemicals in our blood vessels. One of those is a chemical called nitric oxide. Mm-hmm. And when the body doesn't have enough of the nitric oxide, it actually causes our blood vessels to constrict, to get narrow. And so that's actually a different way. It actually narrows blood flow to certain areas. And so once again, you're not getting the blood flow that you need. And while it probably isn't as responsible for some of the issues with pain that we see, it does lead to some of the other complications with sickle cell. The issues, as we're probably going to talk about with priapism, it probably causes some of the problems in the heart and in the lungs that we call pulmonary hypertension. And it also, some of the skin ulcers that folks with sickle cell can get are related to that. So it's a different mechanism that causes that. Interestingly, patients have sort of a different amount of that. There's some patients who almost predominantly have issues with the what we call the pain crisis, or where the blood vessels being blocked off by the blood flow. There are other folks who almost predominantly have the issues with the low nitric oxide and the constricted blood vessels. By far the majority are somewhere probably in between. But there's so many other variables that are there that sort of will impact where people fall on that spectrum, and that oftentimes leads to even though they have the same genetic change in their body, they manifest and end up with different complications.
Very well. You explain that very, very well. You know, I think so. Part of what you're saying is that in some cases, sickle cell patients are experiencing kind of like a 1-2 punch, where the nitrous oxide issue is causing the constriction, which then therefore is making it even more difficult for sickled cells to flow through.
Absolutely.
Wow. Okay, and we've also, in the past, we've talked a little bit about the fact that no two patients seem to manifest exactly the same. And that's one of the characteristics of sickle cell that, in a way, is fascinating, and then also, in a way, it's very, very challenging. It makes it challenging to treat the disease.
Absolutely. It is fascinating from my standpoint. I have young folks, people in their early 20s who actually unfortunately pass away from the disease because of all these complications. But I have a few patients who are in their 60s or even 70s with sickle cell disease who really have actually done quite well over time. And it's amazing. people much smarter than me have been able to figure out that sickle cell, while we classically think of it as being people of African descent,
Right.
it didn't really start in just one place in Africa. They've been able to figure out that the mutation, the change in that gene, probably originated in at least 4 different places in Africa.
Mm-hmm.
It actually originated at a place in the Middle East,
Mm-hmm.
and it even originated at a place in India.
Mm-hmm.
So it's developed or been found in different areas. And based on really where your genes are originally from, that actually has an impact on the disease. There are probably things that people have that we know can potentially protect them. So that their other genes in their body actually potentially protect them from some of the bad things that can happen because of sickle cell. Unfortunately, many patients don't have those protective mechanisms and suffer much more.
What might be some of those protective mechanisms?
So one of the fascinating things is, and we see it a little bit more in probably Northwest Africa, is that our hemoglobin is made up differently. So there's what we call the adult hemoglobin.
Right.
And so probably over 95% of normal hemoglobin is this adult hemoglobin. And then there's a little bit of another hemoglobin. But when we're a fetus, when we're in our sort of mother's womb, we actually have a different type of hemoglobin, which we call baby or fetal hemoglobin.
Right.
And that hemoglobin doesn't have the mutation in it. That's
Right.
a normal hemoglobin.
Right.
And then once we're born, we start converting from making that baby hemoglobin to the adult hemoglobin, which occurs really in the 6 to 12 month of age range. Well, there are some people who have changes in their gene where their body doesn't completely make that switch.
Okay.
So for their entire lives, they will have maybe 15 to 20% of their hemoglobin being that baby or fetal hemoglobin.
Mm-hmm.
And one of the medicines that we commonly use for sickle cell now is hydroxyurea,
Right.
which one of its goals is actually to raise that fetal hemoglobin.
Right.
And so there's some people who are just born naturally to have that.
Okay.
I will never forget, there's a young woman who I still see who came originally from Nigeria to study at IUPUI's campus. And she went into student health, and they told her, "You have sickle cell disease." She says, "No, I don't." And they said, "Yes, you do." She goes, "No, I don't. I know what sickle cell disease is. I've seen my cousins suffer from it. I don't have any of those symptoms. I don't have that." And so they sent her over to see me, and I probably said, "Well, you do have sickle cell."
Right.
And then I explained to her, when we looked at her blood, she had probably about 18% of that baby or fetal
Okay.
hemoglobin in it. So she sort of had an internal protective mechanism.
Understood. Right.
And actually, she really did very well. And I think at the age of 30 or 31, she got a bad flu. So she got really sick and had her first sickle cell crisis of her life. And it's just sort of fascinating how somebody who has that same mutation was fortunate enough to have one of these protective mechanisms to actually protect her until she got really sick.
Wow. Fascinating discussion so far with Dr. Rakesh Mehta, and we're going to take a break and come back and hear some more. Welcome back to the Sickle Cell Action Network service of Martin Center Sickle Cell Initiative, and brought to you by Mass Therapeutics. We're speaking with Dr. Rakesh Mehta, and he's just doing really well, even in our discussions during the break. So we're going to go back into our topic of medical complications with sickle cell. And you'll see that Dr. Mehta is a wealth of knowledge, and I'm just grateful that he's here to share his knowledge with you. And we're going to start getting specific now if we can. Every organ and system within the human body is essential to a person's health, so it doesn't really matter where we start when we start this discussion. So why don't we start with the brain? Would you please tell us about the kinds of impact that sickle cell can have on the brain?
So, obviously, probably one of the most devastating complications that we see in children is the likelihood of stroke. And my pediatric colleagues do have mechanisms, transcranial Doppler studies, to sort of look at blood flow to try to help with that. In the adult patient, I think the issue sometimes with strokes is, again, sort of dependent on your makeup. A lot of young folks will present with that pretty early on. Oftentimes, by the time they become an adult, it's almost like if they were going to have strokes, they were going to have them at a younger age. It may not be, when they're younger, as much of an issue. However, things that cause strokes in adults, high blood pressure, diabetes, smoking, high cholesterol, those kind of things are risk factors if you have sickle cell as well. And I almost wonder if it's a little bit of a bigger risk factor, because if you start narrowing those blood vessels, then the likelihood of a stroke is probably going to be higher in somebody with sickle cell who sort of develops some of these other sort of adult illnesses that start to occur. But I think one of the other aspects of it, which is related very clearly, that I think we're starting to recognize, is that in kids, when we think about a stroke, we usually think where somebody, suddenly maybe can't move their arm, or they can't move their leg, or they lose sensation on one of their sides of their body. So that's sort of a big stroke.
Right.
But we're also recognizing that there's probably sort of small strokes that are causing damage that don't necessarily cause an overt physical finding, so that they don't all of a sudden slur their speech, but there's damage. And unfortunately, some of that damage may actually be in areas that sort of impact our abilities to think, our abilities to learn, our abilities to reason. And I think, what we sometimes see in sort of young adults is sort of potentially behavior issues, or trying to get them to understand why it's important to take certain medications, and it's hard for them to comprehend that. And it's, if you actually probably go back and do very detailed imaging of their brain, they probably had these tiny strokes that are impacting that. So there's the big issue of a stroke that we see, but unfortunately there's these sort of tiny issues that unfortunately probably rob them of some of their intellect and some of their ability to reason and learn and understand, and potentially maybe even create behavior issues because of the fact that their brain's already been damaged from the sickle cell.
So is it possible that these are like cumulative events that may lead to that?
Absolutely.
Okay.
I suspect that in many respects they are. And they're subtle enough that, a big stroke you see right away, but
Right.
these smaller ones are probably subtle enough that it may be several years of damage that's occurring
Right.
before anybody's able
To really notice it.
to notice it.
Okay. We've had Dr. Monica Curana, Dr. Emily Meyer, both pediatric hematologists, on some of our recent shows, and they both spoke about the importance of transcranial Dopplers in children. What can you tell us about the use of TCDs on older patients? Is that something that is done? And if so, would you explain the need for it? And if it's not, why not?
So it's not something that we've commonly done in adults. It doesn't seem to predict the likelihood of stroke like it does in children. It may be that we're dealing with a little bit of a different population because they're still growing, and so observing blood flow in that patient is potentially more significant than an adult.
Okay.
So in adults, we typically don't have to do that.
Okay. So is there anything else about the brain that you think we need to be concerned with before we move on?
I think sort of maybe potentially related, because it's right there by the brain, are our eyes.
Right.
And the eyes are definitely something that can be damaged as time goes on in sickle cell disease as well. Probably in many respects similar to the damage that happens in diabetes, that the eyes can sort of create extra blood vessels to try to get extra blood flow to the eyes, and those blood vessels are weak and can potentially break and bleed, and if they bleed they cause damage to the back of the eye, what we call the retina, and can actually lead to problems with vision and potentially even blindness. Fortunately, that's something that if it's caught early, they can do something about it. Just like in somebody with diabetes, they can do laser therapy. With sickle cell, if they can see that, what they call sickle retinopathy, with a specialist who really knows how to handle that, they can actually sort of minimize the damage and just sort of follow that along and do things preventatively so that they'll never have an issue with their eyes.
What kind of specialist would that be?
It'd be an eye or an ophthalmologist,
Right.
an eye specialist, but even a subspecialist,
Okay.
which we would call a retina specialist.
Okay. Really good. Good information. So now that we've covered the brain, let's move down to the body into the thoracic cavity. That's where the heart and the other major organs are located. So let's start with the heart. would you please tell us how sickle cell can impact a patient's heart?
Probably the major impact on the heart is something that we would call pulmonary hypertension.
Okay.
And so that sounds like we're talking about the lungs when we say pulmonary, and it is. It's really an interconnection between the lungs and the heart. The heart, if you sort of think of it as sort of this box that collects blood from the body and then has a different box that pumps it somewhere, the right side of the heart is what collects the blood from the body and then pushes that blood into the lungs. That blood from the lungs comes back to the left side of the heart, and then the left side of the heart pumps it to the rest of the body. When we think about sort of high blood pressure, we think about, somebody puts a blood pressure cuff on our arm and measures the blood pressure and it's high. Well, if it's high, one of the things it does is it makes that left side of the heart have to work harder, because if the pressure's higher, to push the blood through something at a higher pressure is harder.
Mm-hmm.
Well, with the right side of the heart pushing that blood into the lungs, there can be things that happen in the lungs that start putting extra pressure on that right side of the heart. So the heart's having to push harder to get that blood into the lungs. And as that starts putting more pressure on that right side of the heart, it can get that side of the heart to actually fail. So all of a sudden, it has a hard time collecting the blood. So the blood gets a hard time coming back to the body. We start seeing swelling in things like the legs, sometimes even in the abdomen. It also, because the right side of the heart is sort of the control center for sending the electrical pulses to the heart to make sure that it works in a coordinated fashion, that it can sometimes start damaging that electrical system and actually send bad signals where the heart will actually potentially acutely stop.
Okay. Are there any interventions or treatments that are used to help reduce the amount of damage that sickle cell can do to the heart? If so, what are they?
Unfortunately, this is a really challenging area.
Okay.
When it's gotten to that point where it's caused that pulmonary hypertension, my lung colleagues do have some medicines that there are other things that can cause that, what we call pulmonary hypertension, that can be beneficial. But in sickle cell patients, we haven't really found that to work. In fact, one of the medicines that they had were doing a study on that had been shown to be helpful in people who would have this condition not related to sickle cell. They tried it in patients with sickle cell, optimistically hoping that it would help, and it turned out it actually caused more harm than good, and they had to stop the study.
Okay.
And so that's, I think, a tricky component of this, and we really don't have probably great ways to correct that once that's happened, unfortunately.
Okay. Of course, the human heart, you said it already, is a pump. It sends blood through the body, it sends blood to the lungs, and it sends the blood through a very complex tubing system that's known as the circulatory system. If I'm not mistaken, the lungs are a part of that circulatory system because they're feeding the blood with the oxygen. What are some of the complications that can occur with the lungs as a result of sickle cell?
So, sort of that pulmonary hypertension is probably linked in with the heart.
Okay.
But sort of one of the very scary complications that we can see with sickle cell disease with the lungs is something that we call acute chest syndrome.
Right.
And this is actually a condition where we don't fully understand what's happening. It's probably related again to that sickling process, but it can actually cause the lungs to fail. It can cause folks to end up having to get on a breathing machine, what we call a ventilator, and unfortunately this is another cause of death in young people with sickle cell disease. Right. It has to be sort of recognized early. We know that it's sometimes not a simple diagnosis. It can actually look like maybe the patient has pneumonia when we do something like a chest x-ray or a CAT scan of the lungs. It kind of looks like pneumonia, but it's not an infection. It's actually probably that sickling process that's occurring. And so you have to sort of recognize that this isn't pneumonia, this is sort of this acute chest syndrome, and start treatment as soon as you can. Treatment in that setting, the two mainstays of the biggest thing that we try to do is reduce how many red blood cells have sickle hemoglobin in it. And so that may just be getting a simple blood transfusion, getting somebody's blood that doesn't have the sickle red blood cells, so that you reduce how many of those sickle red blood cells are in the circulation. What we have a tendency to do a little bit more now, when we have the ability, is to do something that we call an exchange transfusion.
Right.
This is a process where we're able to actually take a little blood out. There's a machine that actually pulls out the red blood cells, and then the rest of the blood gets infused with somebody else's red blood cells. And so we're sort of exchanging their red blood cells for normal red blood cells.
Mm-hmm.
And nowadays, with the technology that we have with this, it's phenomenal. If you can imagine somebody having 80% sickle red blood cells, we can take that percentage down sometimes less than 30% red blood cells, which is actually less than somebody who has sickle cell trait.
Mm-hmm. Wow.
Now, there is one thing that we know that can help prevent that when somebody comes in with a sickle cell pain crisis. So sometimes somebody may come into the hospital with what seems like a regular pain crisis, and then it actually progresses into acute chest. There's these little devices that we have that are called incentive spirometers, which are things that you have to take a deep breath in. And it's actually one of the true good studies that have been done in sickle cell patients that have been shown that simple plastic device, that if it gets patients to take those deep breaths, that can actually prevent them from developing acute chest syndrome.
Great. Well, Dr. Mehta, you're providing us with wonderful information, very concise, very accurate. We're very happy that you're here. We're going to take a break here, and when we come back, we'll continue going throughout the human body and talking about the impacts that sickle cell can have on it. We'll be right back.
Do you or does someone you know have sickle cell disease? Have you heard about the EPIC study? It's an international research study evaluating an investigational drug aimed at shortening the duration of painful crisis. And with over 50 sites in the U.S., there may be a site near you. To learn more and to find out if the EPIC study is right for you, visit www.theepicstudy.com.
Welcome back to the Sickle Cell Action Network. My name is Gary A. Gibson. I am your host. I am President and CEO of Martin Center Sickle Cell Initiative. The Sickle Cell Action Network show is sponsored by MAST Therapeutics, a publicly traded biopharmaceutical company headquartered in San Diego, California. MAST is currently leveraging the molecular adhesion and sealant technology platform derived from over 2 decades of clinical, non-clinical, and manufacturing experience with purified and non-purified polaximers. MAST has developed a drug called MST-188 as a candidate for serious or life-threatening diseases with significant unmet needs. Among those needs is the treatment of sickle cell disease. MAST is currently enrolling sickle cell patients in a clinical trial known as EPIC. EPIC stands for Evaluation of Purified Polaximer in Crisis. If successful, EPIC could result in the first treatment of its kind to treat sickle cell disease patients while they are in crisis. The EPIC study aims to determine whether MST-188 can shorten the duration of a painful crisis. MST-188 is an investigational drug that has not been approved for commercial sale in any jurisdiction for any use. MST-188 potentially improves oxygen delivery and may help keep blood vessels from becoming blocked and more obstructed. It may improve blood flow by stopping cells from grouping together. It may also reduce inflammation, and it may restore cell membranes and give damaged cells time to heal. Interested patients should know that EPIC participants will continue to receive their normal pain treatments during crisis, and that there is no cost to participate. Interested patients should also know that participating in this study could not only help themselves, but might also help future generations of those yet to be born. If you are interested in learning more about the EPIC study, please visit www.theepicstudy.com. Thank you to MAST Therapeutics for the sponsorship. We are speaking with Dr. Rakesh Mehta, and he is providing us with really good information about the impact that sickle cell disease can have on the human body. We're providing this information to ensure that our listeners are informed and prepared for anything that sickle cell might throw their way. So going back to our questions with Dr. Mehta, my next one is, the approximately 60,000 miles of arteries and veins that serve as the tubing for the movement of blood and oxygen throughout the body are compromised in many ways in sickle cell patients. Of course, the most common way that they are compromised is when the red blood cells sickle and block blood flow. Are there any other ways that sickle cell can hurt them? If so, what are they, and how can these issues be treated?
So I alluded to this a little bit earlier with the issues with the nitric oxide.
Some things doesn't it's not a bad idea to repeat. Right. Sorry.
That's all right. And so that's one of sort of the issues that we see is by causing this vasoconstriction, it limits blood flow to areas. And in one of the major sort of complications that we can see with this is sort of these skin ulcers that patients get typically on their legs, which are incredibly painful.
Right.
It's like they have raw nerve endings that cause incredible amounts of pain. The problem is that because you've limited the blood flow, they don't heal very quickly.
It may take months.
May take months.
Yeah.
And sometimes even need things like skin grafting to actually get them to heal. So it's another one of these devastating things that can happen to folks. And probably we wish we'd have a better way to improve the blood flow, because that would be the most important thing that we could do, but we don't have a way to do that, unfortunately.
Mm-hmm.
And so it just takes months and months and lots of times care by skin care specialists to actually get those nasty things to heal.
So are you saying then that is the result of the fact that blood is not getting to the skin itself to keep it nourished, if you will?
Exactly.
Okay. So let's talk about another very important area that can be impacted by sickle cell, the renal system. The primary components of the renal system are the kidneys and the bladder. How can sickle cell impact those organs?
Probably the major organ is the kidney that it can affect.
Right.
And it can do things in different ways. If you can sort of sickle into the kidney, it can lead to sort of damage to the intricate network that is required to actually to allow your body to sort of get the waste products out, to get water out. And so if those areas are damaged, you might not be able to do that as effectively. And
then there's other complications from that.
That's mainly the kidneys failing.
Right.
But along those lines, it can cause issues with high blood pressure. Because if the kidneys aren't working well, they sort of release substances that can actually cause problems with blood pressure as well.
Mm-hmm.
Interestingly, the damage that we see to the kidney obviously can be impacted if you have sickle cell disease, but this is actually one of the complications in people who have sickle cell trait.
Okay, right.
So normally what we would consider not sickle cell, so they're okay, but even people with sickle cell trait can actually have, over the long term, after maybe their third, fourth, fifth decade, to start having issues with the kidney as well, because that's an area that the sickling can actually lead to some issues.
Is there any hypothesis as to why that is? I mean, actually, I remember reading in one of our sickle cell news updates stories about a study that was talking about kidney problems with sickle cell trait, but I don't recall that story said why.
It's sort of the environment of the kidney, sort of having a little bit of a different sort of acid. The pH of the kidney is different. Probably a little bit of an issue also with how much oxygen's in there, that actually can cause the damage to sort of that very sensitive system, which is essentially a bunch of small blood vessels that work in that manner.
Are there any interventions or treatments that can be performed to reduce the risk of damage to the kidney?
Probably one of the major things that in folks with sickle cell disease is if they start getting issues with high blood pressure. There are medications, there are high blood pressure medicines, and there's many different classes of high blood pressure medicines, but there's a class of high blood pressure medicines that have been shown that can actually be protective of the kidney. It's actually, again, it's interesting how there's a little bit of overlap with diabetes, but this is a class of medicines that we call ACE inhibitors, which is sort of high blood pressure medicines that the generic name typically ends with a prill. But that actually can sort of help lessen the damage, maybe not lessen the damage, but prevent further damage when people are on those. And so it's important, while the damage to the kidneys can cause issues with high blood pressure, the high blood pressure can actually exacerbate or worsen problems with the kidneys as well. So making sure that if people are starting to have issues with high blood pressure, controlling that with this class of medications can be very beneficial.
Do you see many patients that have sickle cell and diabetes?
Not too many.
But there are some.
There are definitely some.
Right.
And I think one of the things that we're going to have to start preparing for is that I think as we're starting to get some better treatments for sickle cell disease,
right,
we're recognizing some things and able to intervene sooner. People are now living longer with the disease. And as you live longer with the disease, you're more susceptible to those conditions that all of us are susceptible to
right,
as we get older.
Right. Okay. Good. So everybody likes to eat. Sometimes
I definitely do.
Everybody likes to eat. There's a handful of people, I think, that don't. But sometimes people don't eat the most healthy foods. But once they do, the food that they consume gets handled by the digestive system. The digestive system's major organs include the stomach, the intestines, the liver, the gallbladder, and the pancreas. All of these organs are laced with very, very small arteries and veins, which makes them particularly susceptible to problems for sickle cell patients. Would you take a few minutes and discuss the potential for medical complications in these important organs?
Absolutely. So I'll probably start with the gallbladder.
Okay.
Because this is an issue that it affects young people. And it's the gallbladder's job is to sort of help the body get rid of bile. And one of the things that makes bile is the breakdown of red blood cells, or bilirubin. And so, again, as we talk about the fact that these red blood cells are being broken down in maybe 20 to 30 days as opposed to that full 120 days, you're making more bilirubin. So you make more bile, and you have the greater likelihood to actually make gallstones. And those gallstones, if they block up the gallbladder, can actually cause an infection in the gallbladder or inflammation in the gallbladder that we call cholecystitis. So that can be, again, a very painful complication related to this. And it oftentimes leads to these folks actually needing their gallbladders removed at a relatively young age. So folks in their late teens, maybe their early 20s, end up having to get their gallbladder removed. And they can have symptoms that may be pain, but it may actually just be that they're getting sick every time they're trying to eat, because the gallbladder sort of has to contract and get rid of some of that bile when you eat. And if it's not pushing the bile out very effectively because it's being blocked up by stones, it gives you the sensation of getting sick to your stomach or nauseated when you try to eat. So the gallbladder is definitely one of those areas that get affected.
How about any of the intestines, the stomach, the liver?
Probably the other major one we worry about is the liver.
Right.
And there's really two different issues that can happen with the liver. One is where you can actually essentially have a crisis in the liver, where you can actually cause severe damage to the liver and in fact almost have it fail because you've sort of blocked off so much blood flow to the liver. Fortunately, that's a relatively rare complication, but it is something that we probably see maybe once every other year or so. The other issue that we worry about with the liver isn't directly related to the sickle cell, but is more related to when we try to actually treat people with sickle cell. So one of the common things I've already talked about is transfusion.
Right.
And while I know people oftentimes worry about transfusions with the infectious and those kind of common infections and various diseases that you might get from a transfusion, those are actually very, very rare. But every time we give a patient a transfusion, there's iron in those red blood cells,
Right.
and we give them iron as well. And so the body has a very amazing system to hold iron, to protect iron, so we all need iron to make red blood cells. But we don't have a good way to get rid of that iron. And when you've filled the normal stores with iron, you have to store it somewhere else. And the major place it gets stored when you have these issues with transfusions is the liver. Mm-hmm. And that can actually lead, over time, that huge amount of iron in the liver can actually damage the liver and cause the liver to fail.
All right, and that's where there are certain medications that are prescribed to help reduce the excess liver. The excess
iron
yep. in the liver. Right.
So fortunately, for many years, the only way you could do this was through sort of an injection, where you actually have to have an infusion under the skin that went for maybe 10 to 12 hours, 5 to 7 days a week. And it really should probably get started in young people. Well, when I was 20 years old, to be hooked up at night, there was no way I would have wanted to do that. Yeah. Fortunately, they've now developed medicines that can be taken by mouth. The first generation of that was sort of a medicine that you actually took the medicine, which was like a caplet, and you dropped it in 4 ounces of liquid and made a slurry into it, which is a very effective medicine. Doesn't taste very good. Kind of make you sick to your stomach. But fortunately, there's now even a next generation that is a pill, and so we do actually have very effective medicines to help get rid of the iron.
We have one of our future shows. We're going to be talking about dealing with iron overload. So thanks for bringing that up. We're going to step away. We're going to take a break, and when we return, we'll continue our discussion with Dr. Rakesh Mehta. Welcome back to the Sickle Cell Action Network. Martin Center Sickle Cell Initiative brings you the Sickle Cell Action Network. We are a 46-year-old community-based organization that provides services to people with sickle cell disease. We provide services such as food pantry, a support group, transportation assistance, emergency financial assistance, client referrals, and other services as needed. We also provide education to our community by providing or participating in multiple health fairs every year, doing presentations to schools and high schools, and any organization that will give us the platform, we'll go talk to them about sickle cell to try to raise awareness. And we also put a lot of effort into advocating for those that have sickle cell by pushing our legislature, by working with our Congress people and others to try to ensure that they are aware that more support is needed to help those people with sickle cell. And we also are bringing you the Sickle Cell Action Network here on RadioNext.tv, the Cool Groove site. With me is Dr. Rakesh Mehta, and he is providing us with a tremendous amount of information about how sickle cell impacts the body. So far, we've talked about the brain, the heart, the circulatory system, the renal system, and the digestive system. Let's talk now about the skeletal system. We've all heard about how sickle cell causes a condition known as avascular necrosis. What is that, and why does it happen?
So, in our joints specifically, if you can imagine sort of bones sort of locking next to one another to sort of form the joint to allow motion, there are certain of those bones that require a lot of blood flow. And probably one of the major ones is actually the head of the long bone of our thigh, which is called our femur. And it is almost like a little bit of a ball, and it sort of fits into the socket of our pelvis or our hip joint. But unfortunately, you need a lot of blood flow to that area. And it's not uncommon, again, when you sickle, that you diminish the amount of blood flow to that head of that joint, and it actually causes the bone to die. And so when we talk about avascular, that's sort of not getting the blood flow there. Necrosis is sort of the dead tissue. And you end up damaging that hip joint to the point that it no longer works. And so it's not uncommon, again, to see young people in their late teens, they're actually having to have their hip replaced because of the damage that's been caused by that.
We've talked about that a little bit on the show in the past, and one of the things that is disturbing a little bit, I think, is that the hip replacement devices that are used in hip replacement surgeries are not necessarily designed to last the full lifetime.
That's correct.
So what that may mean is for someone who is in their teens or lower 20s that gets a hip replacement transplant, that means they probably will have to have at least one more.
That's correct.
And possibly two more.
Yep.
before they do pass. So that's another problem. Are there any other skeletal issues that you think are worthy of discussion?
One other sort of rare complication that we can see with this is that because of sometimes the damage that's done to the bone, you can sometimes get an infection in the bone. And so, us doctors like to have big fancy words. So osteomyelitis is the term that we use for an infection of the bone. And so that's something that folks with sickle cell are susceptible to. Interestingly, there's a bacteria that can cause diarrhea called Salmonella that seems some patients with sickle cell can actually get that into the bone. And it's almost unheard of in other sort of other people, but
Really?
in sickle cell disease, it's one of the things that we can see.
Okay, that's one thing I've learned today. So is there anything that we can do to help minimize the risk there, with the bones, with the femur, the head, and all those other things?
So, and I'm sort of surprised I haven't talked more about this at this point, but hydroxyurea is really the mainstay for that. In so many different ways that hydroxyurea, we talked a little bit, it raises that fetal hemoglobin level, but it probably does some other things as well that actually can reduce the likelihood of the sickling process, whether it's the pain crisis or the avascular necrosis of the hips. It's sort of an amazing medicine that can and lower the likelihood of that happening.
We're very big proponents of hydroxyurea. We try to encourage those that we work with to ask their doctors to prescribe it if they haven't already, and we are seeing more and more patients getting on hydroxyurea, but there is still a lot of data out there that shows a lot of people still aren't taking hydroxyurea. Is it a standard practice for you to try to recommend and prescribe it?
Absolutely. I think there's two issues: getting people prescribing in the first place, but then also getting the right dose.
Okay.
One pill is typically not enough for an adult. I can imagine from a patient standpoint, it's a little scary when somebody says, I'm going to give you a chemotherapy medicine, and you're like, but I don't have cancer. And so, I think a common concern that young people have, they're worried about hair loss, they're worried about the nausea that we see with other chemotherapy medicines. This medicine really doesn't do that.
Right.
And so it really becomes a very important medicine to take, but you have to sort of get over that fact that I'm taking chemotherapy. But it really isn't for any type of cancer. It's really sort of these incredibly beneficial effects that it has on the body.
And from your perspective, you see that it's working?
Absolutely.
Okay. I think another issue that we've heard about when it comes to hydroxyurea is that sometimes people give up on it because it may take a little while for it to really start working, for them to start noticing the benefits of it.
Absolutely. And I think it's hard because the benefits, again, are subtle. First of all, you have to get really probably to the right dose.
Right.
Whether that's taking 2, 3, 4, 5 pills a day, you have to get to the right dose. But it's not something that it will eliminate having a pain crisis. Unfortunately, you still are susceptible to getting a pain crisis. And it doesn't obviously help acute pain. But what happens over the long term is that the number of those pain crises. So if somebody's being hospitalized 3 or 4 times a year with really bad pain crisis, if the medicine's really working, maybe it's only once a year. And they'll still potentially have pain crisis, but maybe it's not so bad that you can maybe manage it better at home. You don't have to actually get admitted to the hospital. So you're right. It's not the perfect medicine, and so.
But it helps.
It definitely helps.
It definitely helps. And for those of you listening that have heard people and us talk about hydroxyurea before and you've been a little reluctant about it, please listen to Dr. Mehta, who says it does help.
And it not only has sort of helps with those pain crises, it's probably our only intervention that has definitively been proven to prolong survival.
Correct. Prolong survival. Okay, so we haven't talked about the muscular system yet. Every physical action that a human being takes requires the use of muscles. Muscles, like organs, contain many, many tiny arteries and veins and are susceptible to sickle cell damage. Are there any types of muscular issues that can result from sickle cell that you're aware of?
Probably the major is really the pain.
Okay.
I think this is probably, folks will talk about pain in their legs or their back or their chest, and it seems to be sort of the muscles that have sort of an area which is not getting the blood flow that it needs.
Okay. Are there any steps that patients can take to minimize the risk for muscular system problems? Anything they can do?
Obviously, the hydroxyurea, as we just talked about, I do think probably exercise is helpful, but it's really sort of this fine line that you have to walk. Because if you do too much, you can get dehydrated, you can actually precipitate a sickle cell crisis. But it is probably something that is a worthwhile thing to do, and if you can sort of maintain the tone and the strength of your muscles in sort of the right exercise pattern or program, I think it can be quite beneficial.
So you do recommend exercise to your patients?
I do.
Okay, great. We're going to come back in a minute and finish up our discussion with Dr. Mehta. And when we do, we're going to talk about the reproductive system, so people might want to wait around for that. We'll be right back.
Do you or does someone you know have sickle cell disease? Have you heard about the EPIC study? It's an international research study evaluating an investigational drug aimed at shortening the duration of painful crisis. And with over 50 sites in the U.S., there may be a site near you. To learn more and to find out if the EPIC study is right for you, visit www.theepicstudy.com.
Welcome back to the Sickle Cell Action Network. I'm Gary Gibson, your host, and we are speaking with Dr. Rakesh Mehta, and we're getting ready to wrap up our show, Dr. Mehta, but we wanted to cover at least one more of the body's systems before we end the show, and so last but not least for today, we have the reproductive system. The most common complication associated with the reproductive system is priapism in males. What is priapism, and how is that treated?
So priapism is something that affects men. It's essentially where you get in an erection that doesn't go away, where it can last for hours and hours, and that can actually cause damage to the penis and actually to the tissue in the penis. It's one of those things that I think actually young folks figure some of the things they can do out initially, where they get up, they walk around, they try to do things to sort of help with that. But if it lasts longer than a couple of hours, it really is something they probably need to be seen in an emergency department for. There are some medications that may help. Sometimes if it really is lasting longer than 4 hours, unfortunately sometimes it's surgical interventions that have to be done where they're actually literally having to take blood out of the penis to sort of get the erection to go down. And unfortunately, if this happens recurrently, as I said, it can cause long-term damage to the penis and end up causing folks to essentially have sort of almost dead tissue in their penis where it no longer is functional.
Yeah. And then as it relates to the reproductive system, other complications may sometimes include problems with pregnancy in females. Anything you want to say about that?
I think pregnancy is really a tough time for young women with pregnancy. I think the changes in hormones oftentimes really exacerbate the disease. It's not uncommon that young women who we rarely see in the hospital with pain crisis end up being admitted repeatedly because of it. So they seem more predisposed to having the pain crises.
And that might be because of the hormone changes?
And I suspect so.
Okay.
but also some of the complications of pregnancy I think we see they're at a higher risk for, whether it's things like preeclampsia, which is a condition where the blood pressure gets up and you start having protein in the urine. It leads to not oftentimes where they end up going into premature labor. And so it's not uncommon. It's actually, I think, relatively rare to actually see our sickle cell patients get to the full 36 to 40 weeks of pregnancy. They're typically having to deliver early because they go into this preterm labor.
You have provided us with a lot of information, very good information, and you've done it in such a clear and concise manner. We can't thank you enough for being with us today. Is there anything else that we haven't touched on that you might want to share with the audience about sickle cell?
I think one of the important things, preventative things that folks with sickle cell can do is to get their vaccinations. In particular, one of the areas or one of the organs that we don't talk very much, we haven't really addressed, was the spleen. Yes. And the spleen is a very important organ in the body that helps with particular types of bacterial infections. Some people, some young children will actually acutely sickle into their spleen and actually require an emergent splenectomy, meaning they have to actually surgically take the spleen out. But if it doesn't happen surgically, probably over time, the spleen gets so damaged that it is essentially not there anymore. And so there's certain types of bacteria that people are susceptible to when you don't have a spleen. And probably one of the most important vaccines is something that we call the Pneumovax. Mm-hmm. This is, it's probably not, the name isn't great. People associate it with pneumonia, and that's because the name of the bacteria contains pneumonia. It's called Streptococcus pneumoniae, mm-hmm. and it is definitely a bacteria that can cause pneumonia, but it can cause other types of infection. And people with sickle cell, if you don't have a spleen, have a hard time to fight off that infection, and that infection can be deadly. Getting the vaccine, and probably getting it about every 6 to 10 years, can really prevent people from getting that infection.
So, folks, if you're listening and if you're one who has sickle cell, remember to get your vaccinations to try to help ensure that you're minimizing your risk to infections. Dr. Mehta, thank you so much for being with us today.
It's my pleasure. Thank you for asking me to be
here. You've done a great job. So we're going to go ahead and close out the show. As always, I want to leave you with something to think about. We're going to start with a quote that comes from Sri Kumar Rao. His quote is, "There's no destination. The journey is all that there is. And it can be very, very joyful." Sri Kumar S. Rao was born in April 1951. He is a speaker, author, former business school professor, and creator of Creativity and Personal Mastery, which is a course designed to effect personal transformation. He's a TED speaker, and he is the author of the international bestseller, Are You Ready to Succeed? Unconventional Strategies for Achieving Personal Mastery in Business and Life. How many times have you heard someone say that life is a journey? I'm not sure if you agree with this statement or not, but I do. What is a journey anyway? Most of us think that a journey is like taking a trip to some destination. It could be by car, train, plane, or on foot. It could be to someplace exciting, like the Caribbean, or it could be to someplace mundane, like a trip to the corner drugstore. Our days are filled with journeys like these. Sometimes they are journeys we are excited about taking, and sometimes they are not something that we look forward to. Going to the doctor or the dentist fit into that category for me. But there is another definition for journey. The word journey also means passage or progress from one stage to another. So, being born, living on this planet, and then passing on out of this world is perhaps the greatest form of passage there is. It has been said over and over that we each have our own journeys. I believe that this statement is true. I also believe that there is a higher power that ensures that we get to take these individual journeys, not just for our own purposes, but also for the good of others. If there is something that we can do to help someone else on their journey, we should do it, because our actions contribute to the fulfillment of their journeys as well. In other words, all journeys intertwine for the good of all. If you have sickle cell disease, you may often wonder why it is you that is on this journey of pain and loneliness. You may wonder why that higher power picked you to pass through this world in this way. It is truly understandable that you might ask yourself these questions. I know that I would if it were me. But I don't have to wonder about that because I have my own list of questions to ask about my existence. One of those questions is, why have I been selected to help fight sickle cell? Just like you, I don't know the full answer. I just know that this is what I am supposed to do. I know that because this is what I am doing day in and day out. I also know that this is how my journey interacts with yours, and that is joyful to me. The modern-day evangelist Joel Osteen said, God didn't make a mistake when he made you. You need to see yourself as God sees you. I think he also could have said, God didn't make a mistake when he chose you for your journey. You need to see your journey as God sees it. Think about that for a moment. Among other things, your life with sickle cell is your opportunity to show God and all of us that you are the right person for this very special journey. That being said, perhaps it is okay to change the question of why me to how can I ensure that my journey is joyful, not just for me, but for those who love me as well. This may seem like a tough task at times,